In view of the surge of monkeypox cases in the Democratic Republic of the Congo and in several countries, the World Health Organization had declared monkeypox a public health emergency of international concern on August 14th. This is the highest warning issued by the World Health Organization regarding any outbreak. World Health Organization Director General Dr. Tedros Adhanom said in a press release, "The emergence of a new clade of monkeypox, its rapid spread in Eastern Democratic Republic of the Congo, and the reporting of cases in several neighboring countries are very worrying." On top of outbreaks of other monkeypox clades in Democratic Republic of the Congo and other countries in Africa, it's clear that a coordinated international response is needed to stop these outbreaks and save lives. There are two strains of monkeypox, Clade 1 and Clade 2. The newer strain is the Clade 1b. World Health Organization says this strain spreads mainly through sexual networks, and its detection in countries neighboring the Democratic Republic of the Congo is especially concerning, and one of the main reasons for the declaration of the public health emergency of international concern. Clade 1b is prevalent in 4 neighboring countries of Congo: Burundi, Kenya, Rwanda, and Uganda. Thailand has recently confirmed that a monkeypox case reported this week was the Clade 1b strain of the virus, the second confirmed case of the variant outside of Africa. The first case was identified in Sweden. The case identified in Thailand is a 66-year-old European man who had arrived in Thailand last week from an unspecified African country where the disease was spreading. Human to human, touching, sex, and talking or breathing close to someone with monkeypox can generate infectious respiratory particles, but more research is needed on how the virus spreads during outbreaks in different settings and conditions, says World Health Organization. What scientists do know is that it is also possible for the virus to persist for some time on clothing, bedding, towels, objects, electronics, and surfaces that have been touched by a person with monkeypox. Someone else who is in contact with these items may become infected without first washing their hands before touching their eyes, nose, and mouth. The virus can also spread during pregnancy to the fetus, during or after birth through skin-to-skin contact, or from a parent with monkeypox to an infant or child during close contact. Although getting monkeypox from someone who is asymptomatic has been reported, there is still limited information on whether the virus can be transmitted from someone with the virus before they get symptoms or after their lesions have healed. Humans to animals. Since many species of animals are known to be susceptible to the virus, there is the potential for spillback of the virus from humans to animals in different settings. People who have confirmed or suspected monkeypox should avoid close physical contact with animals, including such pets as cats, dogs, hamsters, and gerbils, as well as livestock and wildlife. Animals to humans. Someone who comes into physical contact with an animal which carries the virus, such as some species of monkey or a terrestrial rodent like a tree squirrel, may also develop monkeypox. Such exposure can occur through bites or scratches, or during activities such as hunting, skinning, trapping, or preparing a meal. The virus can also be caught through eating contaminated meat, which is not cooked thoroughly. Monkeypox symptoms typically begin with flu-like signs such as fever, chills, headache, muscle aches, and fatigue. These initial symptoms are followed by the appearance of a rash, which is a hallmark of the disease. The rash usually starts on the face and then spreads to other parts of the body, including the hands, feet, and genital area. The rash progresses through several stages, including flat red spots, raised bumps, and eventually, pustules that crust over. Other symptoms may include swollen lymph nodes, which can be a distinguishing feature from similar illnesses like smallpox. Some people may experience back pain and respiratory symptoms such as cough or sore throat. In severe cases, complications can arise, such as secondary bacterial infections or issues with the eyes. It is essential to seek medical advice if these symptoms appear, especially if there has been exposure to a suspected case or contact with infected animals. Yes, monkeypox can lead to severe outcomes. Without proper care and management, it can lead to pneumonia, corneal infection with loss of vision, pain or difficulty swallowing, vomiting, and diarrhea causing severe dehydration or malnutrition. Sepsis, that is infection of the blood with a widespread inflammatory response in the body, inflammation of the brain, that is encephalitis, inflammation of heart, that is myocarditis, Inflammation of rectum, that is proctitis, inflammation of genital organs, that is balanitis, or inflammation of urinary passages, that is urethritis, or death. The U.S. CDC recommends the vaccine, JYNNEOS, against monkeypox. The virus that causes monkeypox is related to the virus that causes smallpox. JYNNEOS is a 2-dose vaccine developed to protect against monkeypox and smallpox. People need to get both doses of the vaccine for the best protection against monkeypox. The second dose should be given 4 weeks after the first dose, it says. Meanwhile, Africa is expected to receive the first batch of monkeypox vaccines soon. The first 10,000 monkeypox vaccines are finally due to arrive next week in Africa, where a dangerous new strain of the virus, which has afflicted people there for decades, has caused global alarm, Reuters reported. Wash your hands. Wash your hands with soap and water, or use an alcohol-based hand sanitizer, especially before eating, touching your face, and after using the bathroom. Avoid close contact. Avoid close skin-to-skin contact with people who have a rash that looks like monkeypox, and don't touch their rash or scabs. You should also avoid kissing, hugging, cuddling, or having sex with someone who has monkeypox. Avoid sharing. Don't share eating utensils or cups with someone who has monkeypox, and avoid handling their bedding, towels, or clothing. Avoid animals. Avoid contact with animals that can carry the virus, like rodents and primates. Get vaccinated. Check with your healthcare provider to see if the monkeypox vaccine is recommended for you. The smallpox vaccine is about 85% effective in preventing monkeypox. Isolate yourself. If you have monkeypox, isolate yourself from healthy people and avoid contact with others until all of your lesions have scabbed. If you can't avoid being in the same room as someone else, you can try limiting their risk by avoiding touching each other, cleaning your hands often, covering your rash with clothing or bandages, opening windows, wearing well-fitting medical masks, maintaining at least 1 meter of distance from others,